Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you for joining us again this week.
Hi, good afternoon.
Good afternoon. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, this is one of the first times that we are doing this chat on YouTube. We're usually on another platform. So if you're new to this is how it works. We have been collecting questions for the doctor over the past week. She's never seen them before. All the answers are off the cuff. We'll present them to her today. The questions to her today. If you have not had a chance to submit your questions on our website or through social media, you can still do so in the live chat in this broadcast, and we will try to get to as many questions as we can in this short half-hour period that we have with the doctor. Bear with us for any technical difficulties. It's the first time we're doing this on YouTube with the doctor, so we'll get started right away and then figure it out as we go along. So, doctor, are you ready for the questions today?
Yeah, let's go.
Wonderful. Okay, so we're going to start with my cache of questions. And what we do usually is we start with vaccine questions because they seem to be top of mind for many, many months now. So let's start with Yash's question. Yash asks, is Canada considering adding other vaccines like Sputnik to its approved list of vaccines? Some people may be more comfortable taking a vaccine that is developed using the old techniques rather than mRNA, which is a completely new technique.
Okay, so good question. So in order for a vaccine to be approved by Health Canada, the manufacturer actually has to submit an application to Health Canada. And that's how then Health Canada does the review and approves it. Health Canada doesn't go searching around the world looking for vaccines and saying, okay, this is a good vaccine, let's approve it. It's up to the manufacturer to submit it. And so if a manufacturer submits the vaccine, then Health Canada will do its review and decide whether to approve it.
Right, okay. And then let's move on to Sam's question. Sam asks, has there been an agreement with other countries that if you have had a mixed schedule of Pfizer and Moderna vaccines, you are considered fully vaccinated?
Yeah, so I think you really have to, it really depends on what country you're going to. People talk about, well, I can't go to the US with a mixed schedule. Well, actually, the US doesn't have a vaccine policy for entering the US, despite what people think or have heard. So I think it's very dependent on each country to come up with their own policies. This is certainly something that is at the federal level, even at the WHO level, to try and get to some sort of consensus. It's all changing rapidly. And so even in the US, though, they have a provision that if the vaccine that you need is not available, it can be interchanged. And so that 2 doses of any messenger RNA vaccine is considered a full series.
Okay. And let's move on. Jay Bedford asks, I received the AstraZeneca for my first shot, and because of the issues with the vaccine, we went ahead and got Moderna for our second shot. The side effects from the first shot were really bad, but the second shot, I got extremely sick for 2.5 weeks. Has anyone else had the same? Have we heard of this? Is it common? It was to the point of possibly calling 911.
Okay, so I'm sorry that you had side effects after the vaccine. I would recommend that you see your doctor or nurse practitioner to get the side effects reported to public health. The only way we'll know if other people have had these side effects is if they get reported. We do know from the studies, though, that if you had AstraZeneca for your first dose and then get a messenger RNA for your second dose, your side effects can be stronger with that series. So we do know that much. And I'm glad to hear, though, that your symptoms are better.
Right, absolutely. And doctor, we were talking about reporting. Let's just go over that one more time. When it comes to, a side effect that is extremely strong or perhaps unusual, you haven't heard about it, what is the process of going about reporting it, whether to your doctor or to public health?
Yeah, so good question. I mean, we expect you to get a sore arm. We expect maybe you might have a fever for a couple of days. That's not the stuff that needs to be reported. But if you have either a severe side effect, an unusual side effect, or something that lasts for longer, then you can see your family doctor. a pediatrician if it's a child, and they can fill out a form to report to public health. You can also fill out the form yourself. It's available on a public health website, and submit it. And then the public health, like at Toronto Public Health, we do an investigation for every report, which includes getting some of that medical information for any tests that you may have had done as well.
Okay, and then it goes up from there. And is there a national registry? Is there something that where we're collecting this data?
Yes, that's right. So locally, each public health unit then does their investigation and then reports it. Public Health Ontario collects it for Ontario and reports on it. So they have a report that they put out weekly as well. And then nationally, it gets reported from each province. And the Public Health Agency of Canada also then has a report. It's anonymized. It's just numbers. It's not about particular cases, but to keep track of it. Yes.
Right. Okay. Wonderful. And then let's move on to BB's question. BB asks, how safe is a third dose of the vaccine?
We don't know, actually. So, you know, that's one of the points on the third dose of vaccine. First of all, it's not recommended in Canada right now. And we need to be able to show that if you're getting a third dose, that it is safe and that it works, that it's necessary. The places that are recommending that third dose are really for people who had a very weak immune system. And so we know that any vaccine is not going to get the best protection, and they may need a third dose, but that's not currently the recommendation in Canada.
Right. And then David has a series of questions, so we're going to take all of them. David says, what are the stats behind a vaccinated person versus an unvaccinated person transmitting COVID-19 to somebody else?
Okay, so good question. Actually, we have very good data in Ontario on this, and it's actually updated every 1 to 2 weeks or so. And so what we know is from the middle of December until you know, the beginning of July, 95% of people who got COVID were not vaccinated.
Okay.
4% of people who got COVID had one dose of vaccine. And we know before that one dose usually means that they got 70% of them got COVID within the first 2 weeks in which they weren't fully protected. 0.4% of people who were fully vaccinated, 2 doses more than 2 weeks ago, got COVID. And we know, though, that those people that were fully vaccinated and got COVID are less likely to spread it to others.
Right. Okay. And then David's second question, with a toddler at home and a newborn on the way, what measures should I take to keep them safe? I have family members who are both vaccinated and unvaccinated.
Okay, well, I think there's no question that if you're vaccinated, you're less likely to bring COVID into the home, especially you have 2 children who can't be vaccinated. You can consider, especially in indoors, if you need family members to help you, you could consider whether they should wear a mask to help prevent any spread as well.
Okay. And then David's last question, what is the most recent number or stats of pediatric cases of COVID-19 in Ontario? How many in hospital or ICU deaths when it comes to children?
Okay, so I don't have those numbers off the top of my head. It is low in terms of the number that got very sick. Children made up a good proportion of people who got COVID, but very few of them actually got very sick from COVID. And so the numbers would be up on the Ministry of Health or Public Health Ontario's website if you're looking for those particular stats.
Okay. Okay. And then let's take a question from Twitter here. Sab asks, why are vaccines such as Sinopharm approved by the World Health Organization, but they're not accepted in Canada? And if not, will those people who have taken that vaccine have to take additional approved vaccines in Canada?
Okay, so the reason why it's not approved in Canada is, first off, probably because the manufacturer has not submitted to Canada. In order to submit for licensure in Canada, they have to meet certain criteria, and so they may not have met that criteria just yet. So that's one thing. In terms of if you got that vaccine, the policy right now in Ontario is if you got one dose and didn't complete your series in the country where you got it, then when you come here, you can document that dose, so get it put into the system and be eligible for a second dose so that you have 2 doses of vaccine and are completed, considered up to date. Unless you got the Johnson & Johnson vaccine, in which case 1 dose is considered a complete series.
Okay, perfect. And let's take a live question that's coming in here right now. Jaskirat Singh asks, can you please tell me if there is any quarantine plan for international students who are fully vaccinated coming in from India?
So right now, the federal quarantine requirements are that if you have been fully vaccinated with a Health Canada approved vaccine and you meet the criteria, like you have no symptoms, then you need tests done but don't need to quarantine. But if you're fully vaccinated with a non-Health Canada approved vaccine, then you will be required to quarantine.
Right. And as far as I understand, I have family in India, and I understand that India has Covishield or the AstraZeneca equivalent. So that is approved in Canada, correct? So that would be okay?
That should be okay, exactly. Yeah, but for the specifics, it's better to follow up with, the federal guidance on that. But yes, it's a Covishield and AstraZeneca are both Health Canada approved vaccines.
Okay, wonderful. Okay, we'll go back to our submitted questions here. Jeanette asks, Jeanette's is actually a comment, but I chose to frame it as a question because this is not something I've heard recently. They say, my doctors in the ICU reported my case after my vaccine. I had a deadly allergic reaction, swelling of the throat, face, blood clots in the lungs, pericarditis, strokes, etc. I'm a high risk, and therefore I've been told to not take a second shot. So is this common? Is this something that we're seeing often, or is it like a rare one-off where you're so allergic and you've had such bad reactions that you can't even take your second shot?
Okay, so severe allergic reactions like anaphylaxis are rare. They occur in about 1 in 200,000 people who get the vaccine. Typically, though, it can be treated right away. That's one of the reasons why you stay in clinic for 15 minutes to get that treatment. But it sounds like this person is describing more than just a severe allergic reaction. Maybe they had other things that occurred as well. And so I think on a case-by-case basis, it's up to the doctor to help the person understand, whether a second dose would be recommended. It certainly is not common. No, if that was part of the question, and it's not common to have these severe reactions, in which case you cannot get the second dose.
Okay. And then Rhonda asks, can you travel to Canada from the US without getting the vaccine?
So my understanding is that in August, the borders will be open to Americans to come here if they are fully vaccinated. And so, again, I would follow up with border services. They will have to download the app, input their vaccination information in there. Right.
I find it, at this point, I find it difficult to believe that you will be allowed to travel without being vaccinated. But August is 2 days away, 3 days away. So we'll see what happens then for sure. Okay, and then let's move on to Janice's question. Janice asks, if you have had COVID and have received your 2 COVID vaccines, can you catch the virus a second time? And if so, how long does your immunity to the virus last?
Okay, so it is not very common at all. So 0.4% of all of our COVID cases have been in people who had 2 doses of the vaccine. Most of those people who got COVID when they were vaccinated had mild infection, minimal symptoms, were tested and it was found to be COVID. And so if you got COVID like that, your immunity, we don't quite know if you had COVID, how long your immunity lasts from the natural infection. It would act to boost your vaccine response as well too. So your immunity is likely to be longer lasting.
Okay. And then, Denise and Will have a similar question. So I'm going to ask Denise's question. What are the long-term side effects after being vaccinated with Moderna or Pfizer? Are there any reactions in mice after 8 months of being vaccinated? I don't know if you're part of those clinical studies, doctor.
Yeah, I don't know what the studies in mice have shown. And I think, the Moderna and Pfizer trials started a year ago. They were in the summer last year. and we are not seeing reports of severe long-term side effects in people who are vaccinated. We are certainly seeing that it is preventing COVID, and COVID has severe and long-term side effects associated with it. So it is preventing those severe long-term side effects for sure.
Okay. And then that brings us to the end of our vaccine questions for today. Let's take a live question that's coming in from our website right now, from Stuart. I'm just going to read this out the way it came in. Stuart says, given the most important outcome of the vaccine is to dull the effects of the disease and preventing hospitalizations, wasn't the lockdown implemented to reduce the strain on our hospitals? At what point should the focus and counts move away from daily case counts to daily hospitalizations? They say that hospitalizations were at between 5 and 6% of total cases. If the number reduces to 0.1%, then isn't total new cases less relevant, if at all?
Yeah, it's a really good point. I think it's more than just always about one number. And I think if you look at Toronto Public Health website, the Ministry of Health website, there are a number of numbers there that we have to keep track of. Some people talk about the reproductive number. It's above 1. What does that mean? What about the percent positivity? What about the vaccination rate? So I think it's more than just about hospital rates of COVID, though that is definitely very important. You'll see that the approach that the UK has taken, where they're allowing more COVID to spread and keeping an eye on their hospital capacity to be able to determine when they need to have more measures in place. So it's definitely a balancing act. And I agree with you that the daily case counts are not the only measure that we need to be looking at. I think, though, the one way in which the daily case counts are helpful is to see if you're starting to see an increasing trend, because if you start to see a trend in your increasing counts, eventually it can spill over to the healthcare system. Hospitalizations are what you might are late. By then someone's had an infection for at least a week and are hospitalized.
Yes, absolutely. So it's sort of, I guess, just following the daily numbers gives you maybe a little bit of a head start, at least to prepare if at all things get really bad.
Yeah, and you have to really look at the whole package as well. Yeah,
absolutely. Okay, so let's go back to our submitted questions here. Daniela asks, what test must be done 72 hours before returning to Canada from Florida? Is the NAAT the only acceptable test to get on your return to Toronto from Florida? I'm not familiar with the NAAT.
Yeah, that's a really good question. That's a specific type of molecular test. I'm going to have to ask you to follow up on the federal website to see what tests are accepted in order for you to board your flight, because the airline may have something, and then the host country may also have something. So please do check that carefully, or call your airline to find out.
Okay. And then we have another live question coming in. I believe this one is from our website as well. Annie asks, I had pins and tiredness for several weeks after the first Pfizer shot. Pins is on the serious side effects list for Pfizer. I'm assuming like pins and needles. Should I get the second shot? My general practitioner says it is something that I need to decide. What should I do?
Okay, so I think if you're having trouble deciding what to do and you had a side effect from the vaccine, you could ask your general practitioner to refer you either to a neurologist or an allergy specialist to get a better assessment. It's really difficult for me to give you exact advice. I don't know your full clinical picture, but I think if you're looking for more guidance, you can certainly get referred to get some of that, have that conversation.
Right. But doctor, when it comes to the pins that she mentioned, is that common, or is it a dangerous side effect by any chance in terms of the Pfizer vaccine?
Yeah, so, tingling or pins and needles is not a common side effect. Again, we're actually asking everyone who has had a side effect, a neurological side effect, a severe side effect, to report it. Yeah. Again, it's hard to know what exactly is caused by the vaccine versus not, and only when we report everything that we can keep a close eye on this.
Right, okay. And I'll jump back into our submitted questions here. two questions about the virus being airborne. Leo asks, with talk of COVID possibly being airborne, shouldn't we, as well as kids, be using eye protection in addition to just masks?
So eye protection is the face mask, a visor, goggles. That is eye protection, and that is certainly something that was recommended for staff to prevent some of that spread. It's not necessarily recommended for airborne spread. It's more the droplets, so the droplets that can then get into your eye. And so when you have to wear PPE, personal protective equipment, eye protection is certainly recommended for someone who is contagious with COVID, yes.
Right, but not for regular people. Like if I'm going out to the grocery store, a mask with a filter, 3 layers, that's the usual protection, that's enough.
Right, because when we're going to the grocery store, we're trying to keep a physical distance from others. And if everyone is wearing a mask, that's also going to help prevent the spread as well.
Right, okay. And then the other question about the airborne nature of the virus, this person's alias is important question. They ask, since the virus transfers through the air, how much risk would we be at for secondhand smoke from somebody who's smoking next to us?
Okay, so the way that we know that the virus spreads through the air is through these small droplets called aerosols. So if we cough, if we sneeze, from talking, from singing, those aerosols, because they're so tiny, are suspended in the air. And because they're so tiny, they can stay in the air for a bit longer before gravity makes them fall. Mm-hmm. So I think that's important to understand. So it's still really the spread in the air, but with that closer contact rather than someone who's way off in another part. Not the way measles is spread, where it can linger in the air for 2 hours. Right. So I think that that's what is important to remember when we think about it being spread in the air.
Right. So in terms of secondhand smoke, then if a smoker, say, is contagious and they're sort of very close to you and you breathe that in, is that higher risk then to get COVID?
So it's really if you're close together with someone who's smoking, right, their droplets can be spread to you. Yeah. And so whether the smoke itself has infectious droplets, it's hard to know. But the act of smoking, breathing, they don't have a mask on. And if you're close together, that is the higher risk for sure.
Right, absolutely. Okay, and let's move on to Sol's question. How about family members of Canadian residents? Can they come to Canada without quarantining for 14 days?
So the people who don't need to quarantine, it's really based on, first of all, if you're an essential worker that is, doing a particular job and there's a list for that, family members are not considered essential for that reason. Or if you've been fully vaccinated with a Health Canada approved vaccine and have no symptoms and have met the testing criteria, that's the criteria for not needing to isolate.
Right. So it doesn't really matter if you have relatives in Canada or not.
That's right. The fact that you have a relation is not part of the mix.
Right. Okay. And then, okay, this is interesting. Frank says, what would you say to those skeptics who argue that the experts cannot be fully trusted due to various contradictory recommendations, whether it was about stay-at-home orders and opening schools, or it was about different vaccines? What would you say to the skeptics?
Okay, so I think COVID has been challenging because we've had to change decisions as we learn more information and as our current situation changes. So I think part of the changing recommendations is based on responding to the current situation with the current science that we know. And so I think understanding that is helpful. I would also say find someone who you do trust and talk to them about the vaccine. And often that's your family doctor. If your family doctor prescribes medications for high blood pressure or cholesterol, you will trust them for that. And so talk to them about the vaccine. Go to a trusted person to get that information.
Right. Okay, let's go to Joanne's question. We've got this question a few times, and I think it bears repeating. Joanne says, what would you recommend to take regarding vitamins? Research has stated that people low on vitamin D may have to stay longer in the hospital if they get COVID.
Okay, so there hasn't been any data to show that if you take this vitamin, it will help you prevent getting COVID. So I think that's the important thing. I think there's no question that having adequate vitamins, like we know vitamin D is really important for your health for a lot of reasons. And so making sure that you have adequate vitamin D levels is important, but it's not going to help prevent you from getting COVID.
Right, absolutely. And just speaking from personal experience, somebody who had a severe vitamin D deficiency, trust me, it will change your life. Make sure you have your vitamin D levels up. Everything from fatigue to depression has been connected to vitamin D deficiency, and I've lived it. So definitely vitamin D is very high on my list of supplements every day.
Yeah, and especially in our country, we actually don't, like vitamin D, classically you get it from the sun.
Yes.
Some foods are fortified, like they have vitamin D added to it, but it is a difficult vitamin for us to have adequate amounts. And a lot of people really do need to have supplements, including young babies.
Yeah, absolutely. Considering like we don't have sunshine for a very long time in the year. So, so definitely something to stay on top of. Okay, and then CC asks, this is a question about PCR tests. We haven't had one of these for a while. Why does Canada continue to use PCR cycle thresholds greater than 35?
So each lab has their own cycle threshold cutoff. Canada doesn't particularly have a specific cutoff for the whole country. It's up to each lab based on each, test specimen they're using, the reagents they're using to come up with the cycle threshold number. I know that I can say from a public health perspective, we look at the number. It's not like it's a firm cutoff. It will depend on, does the person have symptoms? How long have they had symptoms for? Have they had close contact? To be able to help understand some of the results.
Right, and we've talked about this before. It's not just about the test result, it's about the risk factors and how likely you are to actually have COVID, right?
That's right. Yeah, that's right. And sometimes you might recommend a repeat test, for example, either right away or in a couple of days to help understand some of that.
Right, okay. And okay, Cole asks, if everyone is wearing a mask and one person in the group has COVID, can the rest of the group still get COVID?
So it's certainly less likely. I guess the person who has COVID is not wearing a mask, I imagine. So they can certainly still spread it. Again, we talked about eye protection. If you have a mask, you still don't have that eye protection. And if someone was close to you, you were wearing a mask, but they coughed on you and it got in your eye, you could get COVID. So really what we know about masks, we're knowing more and more that we used to say that when you wear a cloth mask, you're really preventing your germs from going to others.
Yes.
But now with a fitted 3-layer mask or a medical mask, we know that it has more of that 2-way protection. So it keeps your germs from going to others, but it also protects others' germs from coming into you through the mask.
Right, absolutely. And that's where we were talking about the 3-layer mask, correct? Earlier it was 2 layers, then we were told put in a filter or an extra, even like a paper towel will work as a filter to then increase it so that you are protected, correct?
That's right. And I think it also has to be fitted, right?
Yes.
If you have a 3-layer mask and it's very loose, it's not going to provide that same protection.
Right, absolutely. And then actually talking about 3-layer masks, Cami asks, are 3-layer cloth masks effective against the variants? Should we be wearing cloth masks over surgical masks? I'm reading now that N95 masks are available at places like Costco. Are these the masks that we should be wearing to grocery shop or transit or, any area that has lots of people?
Okay, so good question. So it's really hard to say whether all 3-layer masks have the same protection because they're all made differently. And so there's no standard for cloth masks. And that's why we talk about, well, a medical mask is really the PPE or an N95 mask. The thing about an N95 mask is it really has to be fit tested to be effective. And we're not really doing fit tests when we're handing out N95 masks in the public. And so that's why even if you have a medical mask or a 3-layer mask, again, the 3-layer mask should be good quality material so that droplets can't go through them. And it's really the fit. Part of it is the fit that really determines how well you will be protected when you do your errands. The other thing to note is when we're doing our errands, we should try still to keep a distance as much as we can from others.
Yeah, absolutely, absolutely. And then let's see, no more live questions for now, but we have 2 minutes and I still have some submitted questions here. Okay, let's ask this one. Lots of questions about lockdowns now that we are open, I guess. Why is it that compared to other outbreaks like West Nile or SARS, there were no lockdowns at that time, but this time around we had them for quite a while?
Okay, so West Nile virus is spread by mosquitoes, and so locking down, I mean, I guess if you stay in your home, you can't get bit by mosquito, but we still let people go in the backyard. So that's not going to help prevent West Nile virus. When we had our original SARS outbreaks, they were actually quite well contained. It spread differently. In fact, the original SARS, you weren't contagious when you didn't have symptoms. And with this one, that's the case. And so it depends on the particular bug, how it's spread in terms of what measures will be effective. And we had to go to the lockdowns, and because it was a pandemic, you know, and the virus was spreading quite rapidly, we didn't have a lot of healthcare capacity, and so we had to have more significant measures to get on top of it.
Right, absolutely. And I think when it came to the original SARS, we just didn't see this kind of spread. It wasn't, you know, this massive. We didn't have Canada-wide spread the way we do with COVID.
That's right. And I think the hope is that with vaccines, you know, we will have that extra layer of protection so we won't have to see lockdowns. I think that's really something that I'm watching, you know, south of the border where they don't have very good vaccination rates. And now the Delta variant is really spreading quite rapidly in some US states, and how they are going to manage that.
Yeah, absolutely. And so on that note, that brings us to 1 o'clock. Thank you to everybody that joined in and submitted your questions earlier as well as live. Thank you, Doctor, for taking the time and having the patience to answer all of these questions for us. If you didn't have a chance to submit your questions or you just thought of one, please tune in next week. We will have the doctor back with us to answer more COVID-19 questions. For now, we'll sign off. Thank you so much, Doctor.
Bye-bye.
Okay, bye-bye.